This is the Hope Not Nope podcast,
where we answer your questions and share inspirational stories to fill your soul with hope.
Our mission is to empower hope to those who have been plagued by nope.
I'm Dr. Dylan Caswell.
And I'm Brandy.
And we're here to bring you out of the nope and into hope.
Welcome to the Hope Not Nope podcast. Thank you so much for tuning in. This week's episode is from a listener named George, and George says, I strained my hamstrings and in looking for a solution was told about PRP injections. Is this something that I should consider?
No.
End episode. See you next week.
I like telling stories.
Yeah.
And I have a story for this one that I'm very excited to share. So the reason I went directly for it is because I know George wants to just know the answer.
Yeah.
And that answer is no, but I will share why that answer is a no. But I will say in the sense of it's one of these treatments, we kind of look at it, we'll say in 3 to 4 categories of treatments, and we look at high value treatment, low value treatments, and then there's this weird in between that it doesn't hurt, but it probably doesn't help.
Mm-hmm.
And then there's the fourth, the no value solution, which come to find out people have difficulty understanding what a low value versus no value solution may be. So we'll kind of, when we look at PRP, it fits into the doesn't help, probably doesn't hurt, or no value treatment. And we'll explain why it can fit into those 2 categories here in a second.
Yeah, why don't you first explain what PRP injections are for the people like me that really doesn't know?
Yeah, so PRP stands for Platelet-Rich Plasma therapy, which is done by an injection. So what's the theory behind this? How does this all go down? The thought is, so when you take a blood sample, like a lot of people are like, oh, it's blood. But the blood has specific contents in it. It has plasma, and then it has white blood cells, and then it has red blood cells. A lot of people just think blood, it's just red blood cells. All 3 of those components are in there. The plasma is about 55% of the content in a blood draw. And in that plasma, there are platelets. And what platelets are thought to do is that they carry all these growth factors. And when we look at healing, like a tendon, a musculoskeletal tissue, tendon, cartilage, muscle, bone, whatever it may be, that a growth factor can be very helpful for that. And the theory is that platelets, they carry a variety of different growth factors, like vascular endothelial growth factor, like for blood cells, IGF-1, there's all these types of growth factors that help in repair of the body. So the thought is that if you can extract the platelets from the plasma and then inject someone with a higher density of platelets, that because they have more platelets in that area, the healing time can be improved. That makes sense? Following me so far? So when we hear the theory of it, it sounds incredible, right?
Yeah.
It's not a stem cell. It's nothing like that. You're not adding more growth hormone into somebody. You're taking what they already have. I want to go to this point because it will go to the story coming up here soon. The way that they extract the platelets from the plasma is they take the blood sample, they put it in a like test tube looking thing, and then they centrifuge it, which is like spinning really fast. And when you spin it really fast, the sample will be by the density. So the red blood cells will fall to the bottom, the white blood cells will be the in-between stack, and then the top will be the plasma. So they centrifuge it in order to get the platelets and the platelet-rich plasma out, and then that is what's getting injected into the site of injury. So it sounds fancy, it sounds incredible, it seems like you're using your body's own sources in order to do this.
I feel like it sounds like a scam.
What's the downside in it? Because like you go to these places and people will tell you all about it and how incredible it is and it's groundbreaking and this and that. It has no validity. It has no validity. So Cool if I jump into the story.
Yeah, I just want to say, like, I am a natural, like, skeptic. And so to me, like, if you're not a natural skeptic, you might hear that from a doctor. I don't even know if their doctors are the ones that are,
Yeah.
like, doing the scam, but,
Yeah.
like, maybe I shouldn't call it a scam.
Yeah.
But, like, my natural inclination is to call it a scam and be like, that seems a little sus.
Yeah.
Sounds a little sus, and maybe that's why you said no at the beginning. But if you're not a skeptic, I encourage you to become a little more skeptical when you hear things like this
Yeah.
because not everything a doctor says is true, and not everything a doctor says is meant to be the most like helpful thing. And
Oh.
we could go on a this whole episode could go from PRP injections to like let's just rant about that.
Yeah.
But you have a story to tell, so why don't you tell the story?
Oh, that sets up the story so
I
well,
didn't even know.
and I should just go into it, and I'm not going to. Because one other thing I want to hit on from what you're saying of the skepticism is that this one hits on the natural fallacy.
Yeah.
And so who are the providers that typically are offering this? Has to be a medical provider, and it's generally orthopedic
Mm.
providers. And it's generally like, yeah, you don't need to go to surgery. You can try this. But also there's this thing, PRP, and it uses your own body's platelets in order to do this thing. So it hits the natural fallacy of like, well, it's from my body and it's for my body, so it
Mhm.
must be the best thing that's
Oh,
available for it. And so, a lot of times we hear natural and that's from our body and it's using our own resources in order to allow us heal. If that's the case, why do we got to take it out, centrifuge it, and then put it back in?
right.
Your body's already producing more platelets and like it's already being done. You
Yeah.
were already built with these things. So it just wanted to put the natural fallacy point in there.
Hmm.
So the story, right?
Yes.
All right. So one of my buddies that I went to PT school with, he did a review paper on PRP injections.
Mm.
And he wanted to see by looking at all the research that's available out there, what is the benefit of PRP? So he pulled all this research together into a systematic review, and he went in with the intention that he was hoping to see that PRP injections were beneficial.
Mm.
And so you write the hypothesis, you do the systematic review, and then you report the findings in an unbiased fashion that either support or refute your hypothesis
Hmm.
from it. And he did an awesome presentation on it, wrote it up. It was incredible. And you just reported, and he goes, you could do PRP, you could do saline, just water,
Hmm.
salt water, regular water, doesn't matter. Inject into that site. There's no difference in outcome.
Mm.
Short term, medium term, long term, no difference in that outcome. So again, doesn't hurt, may not harm, but here's where it does. PRP is not covered by insurance.
Oh, get that trash out of here then.
So people that are coming out of pocket for this
You're scamming people their money.
are paying about $1,000 for the PRP injection. And if there's not a benefit, it's well, you might need a series of them. And I don't think, I like to believe that not, I like to believe that the providers are not doing it knowing that it's an
Yeah.
intentional scam. I think that they're well intended and they believe that it's actually working because they have not looked at literature
Yeah.
and instead are listening to the company that is selling
Yeah,
the
it's
product.
almost like ignorance is bliss, right? Like they take an oath to do no harm,
Hmm.
but they didn't take an oath to not be ignorant and they're just
Right.
like staying ignorant.
Yeah. Yeah. Or the research that they're reading is biased.
Yeah.
And I'm going to tell the story, and I want to be careful because I don't want people to like riot against the system. But I do want to share this story because it opened my eyes really big. Because I could see this story and people going, so I don't use Google, can't do it. They're always up to something. So I want to be careful with that. So just put that out there. All right. So where was I? So yeah, buddy I went to school with wrote a review showing that there's no difference
Mhm.
between saline injection or PRP. PRP can fall into that no value treatment where it is creating harm because the out-of-pocket cost
Mhm.
that people they might not have the resource and go, well, I need this to get my health back. So in this vulnerable position, I'm going to pay for that, or I'm going to get out a loan to pay for this thing, or take on a medical bill for something that's shown to have no difference than a placebo. Like
Mhm.
no difference. So that's where it can get harmful. If you have resources and you don't care if you lose $1,000, you're going to gamble it, whatever. Okay, then less of a harm other than just like wasting your time
Yeah.
on something that's not going to move you forward. But that's where it falls into those two different
Mhm.
categories. So the other story I have is I went to a conference sponsored by the NFL at the James Andrews Institute, top surgeons, top physicians, top trainers from around the world, and just got to go and be there for 2 days and
Wow.
take in all this info. And at this point, I went into the conference thinking PRP is junk. It is a waste of time. It is pointless. And a presenter got up that worked with an NFL team. I'll try not to use identifying factors, but worked with an NFL team, was very well known in the field, and did this whole presentation on PRP. This particular person also happens to be the head editor or chief editor at a very prestigious journal
Mm.
that is published that physicians would be reading.
Hmm.
So I won't go into any other detail than that.
Seems like a lot of bias there.
Yes. And I was like, okay, this might be biased, it might not be, because he started the presentation with, I don't have any disclosures that I need to announce,
Hmm.
which was like, oh, great. This will be unbiased. Like he doesn't have basically, I don't have any stock in the company that's selling the things that are needed for this product. So
Mm.
I don't need to disclose that so that you know that I'm coming from a research standpoint to give you these answers.
Mm.
Our presentation on how the studies that show that there's no effect on PRP was because the sampling was incorrect. They centrifuged it wrong. And if you centrifuge it the correct way, then we'd start seeing the benefits. And I was like, wow, okay. So this literature is showing that there's no effect compared to saline was because it was prepared wrong. And if a solution is prepared wrong, it's not going to have an effect. It's not going to have the benefit that it could have if it was prepared correctly. So I was like, wow, that changed my thoughts on this. Like the research just isn't there because the sampling of the solution is wrong. So I walked away from the conference. I'm like, wow, okay.
Mm.
I got to go back into the research and see how they prepared this stuff. And luckily, I am very blessed to have a good network of people I can call and ask questions and get mentored from. And I have a buddy that works in the NFL and did a residency at the place that this particular physician
Mm.
works from. And I was like, dude, I need the scoop on PRP now. Because, like, I know what the research is showing, but this very prestigious individual just, like, completely broke down a barrier for me. And I'm, like, just wondering. And he goes, huh, who was it? So I told him the name, and he goes, huh. And I'm like, what? And he goes, that dude has stock in the company that sells the centrifuger.
Oh my gosh.
I'm like,
I don't have stocks, but I do.
so much for the no disclosure.
Yeah.
Like, are you serious? So now the editor in chief that has stock in the company that was sponsoring the event that's selling the centrifuger for PRP is the one that's helping to publish the research and saying that your methodology is wrong because you prepared the sample because you didn't use the right centrifuger to get the centrifuger out to these places. I'm like, you got to be kidding me.
It's a
It's a
scam.
scam. And the person that's supposed to be saying, hey, I'm not biased and I don't have any disclosure to announce had one of the biggest disclosures to announce. So I'm like, okay, you may be well intended with the PRP, but I got to start to question some of your values here
Yeah.
because your slide literally said you don't have any disclosures to announce. Do you not know what a disclosure is? I struggle to believe you don't know what that is given the level of knowledge that you have. Like you just willingly. decided that that wasn't important
Yeah.
when it was a very important, like if you have stock in something different,
Yeah.
I would understand why you're not disclosing that. You have stock in the product that you're saying needs to be used in order to get the research to say that this is the effect.
No.
And guess what? Centrifuge it this way or that way. The research is showing there's no major difference between a placebo and a PRP injection. So, George, there's much greater, higher value treatments that you can put your time and effort into to help recover from a hamstring injury. It's not stretching, it's not PRP injections, it's not modalities. There are other things that you can be doing high value. I think we've done a podcast on hamstring at one point.
Even if we didn't, we have a guide, the to-dos and to-don'ts guide
Yes,
that
yeah.
George or anybody that has any sort of common sports injury, you can get it for free. And we broke down these common sports injuries and said, like, what are the high value, what are the lower value, what doesn't hurt, what you should not be doing. And so he could just hop on there too.
Yeah, and we will put that resource in the show notes so that you can click on it. And again, it covers the to-dos, to-don'ts of not just hamstring strains, but a lot of the other common sport injuries that are out there. So, George, thank you for that question. Save your money, save your time.
Don't get scammed.
Don't need PRP.
That should be the title of this episode. Save your money, save your time, don't get scammed.
Yes. Yes. Hope story time?
Yeah, I have a hope story. It's pretty simple, but this time of year, it's just not to talk about the weather all the time. I don't think we do it all the time, but this time of year is just so nice in central upstate New York. And when we have winter, as long as we do, it's just nice to get out and about. And it's been a huge gift this summer to get out and about. And Dylan and I have gone to new places. We've gone on like walks. I wouldn't call them hikes necessarily, but I guess some of them could be hikes. But we've just like gone out to different places that we haven't been to walk and be in nature and things like that. And just reminded me of making the most of what you're given, but also finding new things in the area that you live that can spark some joy in your life. And I feel like we've done a really good job at doing that this summer.
Yeah. A walk in the woods.
Like a walk in the woods. We went to like a parkway and then found like a little area by some water. And yeah, it's just nice. Like you can walk your neighborhood, and we do walk our neighborhood, but sometimes it's nice to drive, 10 minutes down the road or an hour down the road and have a different sort of experience. And so
yeah, it's like so many times you travel to a new place, so you're checking out all the things that area has to offer, and it's like, wow, this place is so great. And then you forget to do that in your own town that you live in, of like, if someone was coming to visit, where would I tell them to go? Oh, you know what? I haven't been there.
Yeah.
Oh, why don't we go there?
Yeah.
Oh, wow, that's free? Oh, that's for free? Cool, we can go do that and not have to spend and get an awesome experience and get outside and move and all that stuff. So I think that's a good challenge for the week, is to avoid PRP and to find out what are the things in your town that you can do that are cost friendly and provide joy, that are right there for you. Like a lot of times, like, oh, we got to go to this other place. Like, oh, you just got to get out.
Yeah. Love it.
Awesome. Have a great week, and remember, every day is not just a day to be hopeful, but an opportunity to become hope.
The Hope Not Know podcast is meant for educational, informational, and personal development purposes only, and does not constitute any health or medical advice. If you're looking for specific advice, connect with us to work with a Hope coach. The Hope Not Know podcast shall not be liable or responsible for any loss or damage allegedly arising from any information or suggestions in this podcast.